Welcome to InteliDOX version 5, which is now certified as a 2014 edition complete ambulatory electronic health record. This video, which is the last in a series of 4, will help you get familiar with the new features in InteliDOX version 5. In our first video, we demonstrated the changes and additions that have been made to the patient summary screen. To watch that video, click here. The second video showed changes to the patient portal, new options for communicating securely with other healthcare professionals and with patients, and importing allergy, medication, and problem lists from CCDA files. To watch that video, click here. The third video discussed updates to the Med screen, the new Encounters or Electronic Notes feature, and changes to creating clinical summaries for patients who've just been seen in the office. That video is available here. In this video, we'll address changes to some of InteliDOX's reports, including the Security Audit report, the Clinical Search and Reminders report, and reports specific to meaningful use, and the new Clinical Decision Support feature. To run the Security Audit report or the Clinical Search and Reminders report, start by clicking the Reports button. Then click the button for the report you want to run. The Security Audit report lets you see who's created, modified, accessed, or transmitted any patient's information. You can filter the report by date. It defaults to events that have happened today, and you can additionally restrict the report by time. And you can choose to view actions taken by a specific user and/or for a specific patient. If you don't select a user or a patient, the report will be run for all users and all patients. To select what kind of events are included on the report, check one or more of these boxes. For example, to run an Accounting of Disclosures report for a selected patient, which shows how, when, and by whom the patient's information was viewed, printed, or exported for purposes of treatment, payment, or healthcare operations, you could click these boxes. New options on this report include copying of files within a patient's chart, IDOX demographic changes in case someone changes demographic information on the patient summary screen, referrals out changes to track the creation or editing of referrals, care goal changes, portal user changes, and portal usage, which shows who's logged into and accessed information using the patient portal. To include all available information on the report, click the word Show to quickly check all the boxes. If you want the report to be sorted in some order other than date and time, select one of these options, then click View. The Clinical Search and Reminders report has some new options as well. You can now filter the report by patient's preferred reminder method, or check for patients whose preferred reminder method hasn't been entered yet on the patient summary screen. You can still search for patients by problems, meds, allergies, test results, or a combination of those items. And now you can filter the report even further by specifying starting and ending dates for any of those search criteria. Several new sorting options are available, so you can tailor the report to your needs. Meaningful use reports are specific to one doctor, so they're accessed by clicking this MU or Meaningful Use button at the bottom right corner of the doctor's picture. To select a different doctor, click the Physician button and select the doctor from the list. Select the report you want to run using the Report list. You can run the Meaningful Use report for Stage 1 or Stage 2, or a report of the 20 clinical quality measures that InteliDOX supports. Let's start with the Meaningful Use report. Although the requirements for Stage 1 and Stage 2 are somewhat different, the reports are laid out the same way. The left column explains the requirements for each of the measures, and the right column shows how the selected doctor is doing on each measure for the selected time period. The report defaults to today, so you can make sure that all necessary data has been entered for patients who have appointments today. To view the report for a different period, use the Reporting Period drop-down list to select the My Reporting Period option or the Custom Date Range option. Depending on what time of year you start working on meaningful use and whether you're at Stage 1 or Stage 2, you may have some flexibility in your reporting period. So if you're failing some measure for the period that's currently selected, you could try running the report for a different date range using the Custom Date Range option and see if you can successfully attest for a different reporting period. This View option lets you switch between the normal detailed view and a compact format that focuses on the numbers and hides most of the text. In both normal and compact view, the report is color-coded. Green for measures on which you're passing for the selected date range, red for items that you're failing, and gray for items that aren't percentage-based. This includes features that need to be turned on for the entire reporting period, like drug interaction warnings, steps that you need to take outside of InteliDOX, such as running a security risk analysis, or submitting test data to immunization registries or public health agencies. For most of these items, you can click these View Missing Items or View All Items links in normal view, or click on the numbers themselves in compact view to see which patients' charts contain the required data and which are missing the data. You can raise your percentages for some measures by entering data that may have been recorded somewhere other than the required location in InteliDOX. For example, you've probably captured allergy information for virtually all of your patients on your intake forms, but for those shown in red on this list, that information hasn't yet been entered on the patient summary screen. Click a patient's name to jump right to the entry point for that data. After you enter the data, save the patient summary screen, and refresh the report, that patient's name will be shown in green for that measure. To print the report to your default InteliDOX printer, click the Print button at the bottom left corner of the report. The Clinical Quality Measure report is always run for a full calendar year and shows how you're doing on 20 different quality measures, such as recording and controlling blood pressure in patients with a diagnosis of hypertension, not prescribing high-risk medications for elderly patients, recording height, weight, activity counseling, and nutrition counseling for children, and so on. To view detailed information about a quality measure and how InteliDOX determines which patients are included in the totals for a given measure, just click that measure's name. At this stage of meaningful use, you're not required to achieve any specific numbers for any of these measures, but that could change in the future. So you might want to review which patients are counted within each quality measure, what actions are recommended for those patients, any conditions that would exclude a patient from the measure, and how you could improve your performance on a measure. These clinical quality measures are also the basis for InteliDOX's new Clinical Decision Support feature, which we'll discuss shortly. To print the Clinical Quality Measures report, click the Print button at the bottom left corner. To export the information on this report to files that you can submit to CMS, click the Export button. Then select whether you want to create a Category 3 file, which is a summary of all patients and all quality measures for the selected doctor, Category 1 files, which produces a separate file for each patient and for each measure, or both types of files. It may take a minute or two to generate the files, but when that's done, InteliDOX will display the location on the InteliDOX server where the files are stored. Click OK to close that message, and click the X at the bottom left corner of the screen to close the report. The new Clinical Decision Support, or CDS feature, helps you keep on top of tests or procedures that are recommended for patients who meet certain criteria. For example, patients with a diagnosis of hypertension should have their blood pressure checked at every visit. Diabetics should have regular foot exams and A1C checks, and so on. If you've been using InteliDOX version 4.1, you're already familiar with the To-Do column on the appointments list and the To-Do indicator over here at the top right corner of the screen. In the past, these To-Do numbers helped remind you to enter basic information that's required for all patients for meaningful use, like demographics, problems, allergies, and so on. Those reminders are still there, and now there's a second number in the To-Do column and the To-Do indicator that show how many CDS alerts are on for this patient. To see details about the alerts for this patient, click on the To-Do indicator. Different CDS rules apply to different patients. Some rules apply to patients who have a specific diagnosis, such as hypertension or diabetes. Other rules apply to patients of a specific gender and/or age range, such as reminders about mammograms for women aged 40 to 69. The alert message briefly describes what can be done to turn off this alert for this patient. For complete details about a CDS alert, click on the link at the right side of the alert. For Meaningful Use Stage 2, you're required to have at least 5 CDS alerts enabled for your entire reporting period. Your system administrator can help you select and enable the alerts that are most relevant to your practice, and will configure each alert to be displayed only to the personnel who need to see it. If you have any questions about the changes to InteliDOX reports, the new clinical decision support feature, or any of the other changes in InteliDOX version 5, please email us at support@busynet.com or call us at area code 918-858-4440, voicemail option number 2.